You have now completed surgery and are ready for discharge. Your doctor will see you in 2 weeks' time to discuss your results. You may be given an appointment to review your wound in 3 to 5 days' time. We would like to prepare you for home with the following tips that will help you on your journey to recovery.
After watching this video, you will learn some key tips on diet and physical activities, promoting comfort after surgery, care of the affected arm, care of your wound, choosing an appropriate bra, drain care, care after an axillary lymph node dissection, and coping after surgery. Diet and physical activities. After your discharge, you are encouraged to resume a balanced diet. However, do refrain from traditional herbs and health supplements until the wound has completely healed. For the next 2 months, avoid all strenuous physical activities such as swimming and other vigorous exercises. Keep to light activities such as walking. Due to limited mobility of your affected arm, you are advised to only start driving 4 to 6 weeks after the surgery. Promoting comfort after surgery. Take your painkillers as prescribed for the next 3 days. This will promote comfort and help to facilitate arm movements. Common side effects may include slight dizziness, nausea, and constipation. Care of the affected arm. In the first month, avoid using your affected arm to lift heavy loads that are more than 2 kilograms. However, we encourage you to use your affected arm for daily light activities such as cooking and washing dishes. Performing light activities that are within your means can help in regaining mobility in your affected arm. If you had undergone a mastectomy or axillary lymph node dissection, you will be referred to a physiotherapist for arm exercises and care of the affected arm. Do continue these exercises after your discharge as advised. Most patients will be able to regain full arm mobility within a month after surgery. If you had undergone a breast reconstruction, your doctor or nurse will advise you on how to manage and care for your affected arm. Care of your wound. You will notice a shiny layer over the scar. This is a layer of skin glue meant to protect the wound and promote healing. Do not rub or peel off the glue. It will gradually flake off in 3 to 4 weeks. Most patients will need to refrain from showering until the wounds have completely healed. This may take 1 to 2 weeks. Your doctor and nurse will advise you accordingly. Please seek early medical attention if signs or symptoms of wound infection appear. This may be in the form of a sudden onset of pain that cannot be relieved with the use of painkillers, increased swelling or redness at the surgical site, excessive bleeding or discharge from the surgical site, fever of more than 38 degrees Celsius. Should you experience any of these signs or symptoms, please contact the Breast Care Center at 6772-8208 during office hours from 9 a.m. to 5 p.m. for an appointment. If you need immediate medical attention after office hours, please proceed to the National University Hospital Emergency Medicine Department. Choosing an appropriate bra. For patients who have undergone a wide local excision, you are encouraged to wear a non-wired supportive bra for the first month after discharge. You may also wear it to sleep. If you had undergone a breast reconstruction, your doctor will advise you accordingly. If you had undergone a mastectomy, your nurse will advise you on the use of an appropriate prosthesis after removal of the drainage tubes. Drain care. Some patients may have 1 to 2 drainage tubes attached to the wound to remove excess fluids and promote wound healing. Most patients will be discharged with the drains, and your nurse will share with you on how to care for them before leaving the hospital. Your nurse will review your condition at the clinic in the next 3 to 5 days. Once the amount of fluid discharge is reduced, the drainage tubes will be removed. You are required to monitor the fluid discharge rate by indicating the level of fluid on the drain bottle every day. Markings are to be done daily at a fixed time of the day, for example, at 10 o'clock in the morning every day. You will need to change the drain bottle when it is 3/4 full or when suction is lost. Here are the steps in changing the drain bottle. Firstly, wash your hands with soap and prepare a new bottle. Next, locate the connection between the drainage tube and the bottle and apply a clamp on each side of the connection. Disconnect the drainage tube from the drain bottle in a twisting motion. Clean the tip of the tube with an alcohol swab. Take the new drain bottle and connect the drainage tube to it in a twisting motion. Release the 2 clamps and ensure that the fluid is able to flow into the new bottle. If your daily discharge into the drain bottle is less than 50 milliliters for 2 consecutive days, the drainage tube will most likely be removed on your next appointment. Bring the old drain bottles at your next review with your nurse. Never tug at the drainage tube, as there is a possibility of it slipping out of the body. Should the drainage tube slip off the wound, do not panic. Do not attempt to put the drainage tube back into the wound. Instead, apply gauze and adhesive tape to the wound and change them whenever the gauze is soaked. Contact the Breast Care Center at 6772-8208 during office hours from 9 a.m. to 5 p.m. for an earlier appointment to review the wound. Care after axillary lymph node dissection. If you had undergone an axillary lymph node dissection, you will be referred to a physiotherapist for arm exercises. Do continue these exercises after your discharge as advised. Most patients will be able to regain full arm mobility within a month after surgery. You should avoid injuries such as needle injections and blood taking on the affected arm. Avoid taking blood pressure and wearing constrictive jewelry on the affected arm. Clean and apply antiseptic cream on wounds and insect bites. Consult a doctor in the event of larger wounds or if you notice any signs and symptoms of infection. If you had only undergone a sentinel node biopsy, the above information on care for the affected arm does not apply to you. However, do continue using your arm regularly for your daily activities. Coping after the surgery. It is normal to feel shock, anger, a loss of control, and sadness after undergoing a diagnosis and surgery for breast cancer. Allow yourself some time to adjust to the body changes and to recover from these feelings. If you experience persistent low mood or lack of interest in leisure activities, difficulty in sleeping or eating, do contact the Breast Care Center at 6772-8208 during office hours from 9 a.m. to 5 p.m. for an earlier appointment with your doctor or nurse. You are not alone in this journey to recovery. There are several support groups that you can join which allow patients, caregivers, and survivors to share their experiences as well as support and encourage one another.
We are confident that with all this sharing, you will have a quicker and smoother recovery. Feel free to ask your nurse any questions after this video.